So Camilla, start with you, and then I'll go to you, Corinne, and then to you, Minister Dix, to wrap us up. But my question is this. People living with dementia and their care partners tell us that getting a diagnosis is difficult. And you've all noted this, once you get one, the lack of clarity that comes around what happens next, or if the supports they need will be available at that time. We know that a timely diagnosis gives people an opportunity to plan and access treatment and support that may help slow the progression of the disease. And in that same ADI report that was cited in the comments, there is broad public support for that. 97% of people surveyed for that report indicated that having a formal diagnosis is seen as useful. So my question is, how does your party, and Camille, I'll start with you first, how does your party plan to improve the clinical pathway for dementia, thinking about it from pre-diagnosis to end of life?
Yeah, what an important question, truly. And as I hear you repeating a bit of what that report suggests, the one word that really hangs with me from it is normal. That this is a normal part of aging, because we run a serious risk when we start to normalize some things. Because what we have witnessed is that on occasions when we normalize something too much, we get to a place where we just wait to react. And so we don't take those proactive initiatives when we just consider it's just a normal thing. To first start to answer this question, I think we have to address the elephant in the room, though, which is that, as has been stated previously, there are 85,000 residents in BC that are diagnosed with Alzheimer's. But this is likely really just the tip of the iceberg, right? The actual number is probably much higher when we consider those who are undiagnosed, those, like you said, that are still trying to seek a diagnosis, or those that even lack the support system around them to help identify that they need to start this process. So our intention at the BC Greens is that we will invest in primary care so that we can prioritize proactive and preventative care versus that reactionary care that we're witnessing right now. Our primary care model that we just presented will provide the need for a longitudinal relationship with a primary care provider. And we haven't talked about that too much yet, but it's the importance of having someone who has observed you over a significant period of time cannot be overstated when we are talking about conditions like Alzheimer's and dementia. So a longitudinal relationship like this will allow for monitoring changes in status and in behavior that we know are often going unnoticed during episodic care that patients are getting through the ERs or through walk-in visits where they don't have someone that they see consistently, or where there is even a accumulation of their records that can help put together a picture of this person's condition. So we know that the BC residents, they deserve more than Band-Aid approaches. And our plan is to invest in current and future well-being of people. We need to start assigning a value to that. There is value in taking care of our people now and in the future. It diminishes the costs on our province when we don't have as many people flooding into our ERs, but can go to community health centers and get their primary care needs met there. So it is a win-win for all of us. So the last point I'll just make is just a little bit more to elaborate on our recently announced dogwood model that has been proposed by the Green Party, because it is unique in a way. It really centers on the team-based care approach. And I think that's what's coming to light as we're talking about this as well, is that we need to be placing patients at the heart of the system, but we have to ensure that they're never left alone to navigate the system. And that is what we're witnessing right now. So I'm hearing that at the doors. I'm hearing people describe to me the struggles that they're facing. Many of them are using words like they feel abandoned and they feel confused. Because what happens is they may receive guidance from one provider, but then they're left to figure out the next step all on their own. And we are asking this of people that have memory problems and cognitive shifts. So to make it worse, it's a toll that is not needed on those individuals. We know that there is a lack of cohesive supports between these care stages and the provider. So this is how we believe we can truly help treat the people better, is by prioritizing their needs. And that's going to remain our focus. we will truly address the attachment issue that exists in primary care right now and provide people with a team-based model that will help them feel like they're never abandoned or fall through the cracks of this system.
Thanks for those comments, Camille. Corinne, over to you in terms of how you would support moving forward with a clinical pathway for dementia.
Well, thank you very much. I really like everything that Camille said. I don't think that I can add too much to that. What I do want to just say is when we're talking about the pathways, what I didn't hear, we were talking about languages earlier and trying to make sure that information was accessible and that services were accessible, are Indigenous populations. And the need to be able to look at these pathways in a culturally sensitive way, and that what we're doing is not necessarily going to apply to all communities. I think there's probably a question we're going to have on rural and remote communities, is that the pathways there and the services available to transition people from diagnosis to home care to long-term care, that system doesn't exist in those communities. So but I appreciate everything that Camille said, and yeah, we need to invest more in making sure that there's resources for people all along the way.
Thank you for that, Corinne. And Minister Dix, would love to hear your thoughts on this topic.
Well, firstly, we have to do, as we discussed in long-term care, we've got to continue to improve dementia education amongst frontline care providers who are involved in the diagnosis. You described experiences where people don't recognize dementia for what it is. It's a specific condition that affects people, and it often affects people. Jim tells his story of, I think, first being diagnosed when he was 58. Well, that isn't the image in your mind's eye of someone living with Alzheimer's, but that can be the case. It can be the case much earlier. So we have to continue, I think, across to directly respond to your question, to improve dementia education for primary care providers. Of course, we need team-based care, and that's exactly what's been happening. There are 83 funded primary care networks across BC with more than 2,000 FTEs, that's doctors and nurse practitioners and nurses, and sometimes physiotherapists and pharmacists and other healthcare workers who are providing care to people in communities. What makes primary care networks effective is they're not a top-down approach. They're built from the community. Every one of those 83 primary care networks came from submissions by local divisions of family practice communities and indeed Indigenous communities to deliver specific care throughout the system. 2,000 FTEs directly involved in team-based care who weren't there before. You'll remember a promise to bring in primary care networks in 2009. There were zero in 2017. Equally, we've got to continue to build out, of course, and recruit and retain and train healthcare workers. In the last year, it has been called upon by many people to change from the fee-for-service model, which to a new model of paying for healthcare in our province and paying doctors in our province. And in fact, the Green Party asked us to do that, and we, of course, have delivered that. 834 more family doctors accepting patients today than there were when we started the model in 2023. So that is continuing out. We want to address the broader issue of primary care and not just services for dementia care. That is something we have to continue. We can decide to go back in another direction or to cut funding for that, or we can continue to go forward. And I think some of that education has to be fundamental, dementia education fundamental. We're increasing the number of spaces at UBC for doctors by 128. We're adding a new SFU medical school, 602 new training spaces for nurses. In the last 5 years, we've tripled the number of nurse practitioners in the province. But at all of these levels, all of these new healthcare workers, it's a huge opportunity for us to, from the beginning, put dementia care at the heart of healthcare, and particularly of primary care in our province. And that's exactly what those schools are doing throughout BC.
I appreciate your comments, Minister Dixon. I think if there's anything that people who are listening to this discussion today can hopefully take away and appreciate is how nuanced this discussion is in general when we talk about supports for dementia.